Welcome to the COVID-19 Student Update presentation created by Hassan Khatib, Rola Hariri, Danny Ishaka, Melinda Nazi, and Ali Hamoud. This presentation will cover the history of coronavirus, what exactly the disease is, the demographic breakdown of those affected, how it spreads, signs and symptoms, the discussion about preliminary treatment and a potential vaccine, and what we as students and the general public can do to help prevent spread of the disease. Also, we'll mention where to go to for reliable and up-to-date information on the subject. Before we begin, let's talk about the history of the coronavirus. In 2002, we dealt with the issue of severe acute respiratory syndrome, known as SARS, which is a coronavirus strain that appeared in China. As of 2004, there have been no known transmissions of this strain. Middle Eastern Respiratory Syndrome, or MERS, was another coronavirus strain that was first discovered in Saudi Arabia in 2012. With the help of the World Health Organization, they were able to contain it in its initial stages and prevent further transmission. Coronavirus disease 2019, or COVID-19, is the coronavirus strain that we are currently dealing with. This was first discovered in Wuhan, China in 2019 and began to spread rapidly.
What is COVID 19? COVID 19 stands for Coronavirus Disease 2019. The name was established by the World Health Organization on February 11, 2020. It was formerly referred to as the 2019 novel coronavirus, abbreviated as 2019 nCoV. The term novel indicates a new disease that has not yet been identified. Coronaviruses are not new to the human population. They are a large group of viruses that infect both humans and animals. Human coronaviruses that present with mild common cold symptoms are listed on the slide, with the abbreviation HCoV indicating human coronavirus. Coronaviruses that infect animals can eventually evolve and infect humans, making them new human coronaviruses. This was the case with the historical severe acute respiratory syndrome, known as SARS, the Middle East respiratory syndrome, known as MERS, and currently COVID 19. COVID 19 is suspected to have originated from an animal reservoir, most likely bats. However, this is still under investigation. Human coronaviruses continue to circulate amongst the human population, causing respiratory infections in children and adults worldwide.
The first cases of COVID 19 were reported in Wuhan, China. It has now become a global pandemic affecting patients in most parts of the world. The following information is accurate as of March 31st, 2020. First, let's look at things on a global scale. To date, there have been just over 840,000 cases reported worldwide. Of those, 176,000 have recovered, meaning there are 664,000 active cases. The number of reported deaths is currently at 41,000. The countries with the most cases are the United States with 180,000, Italy with 105,000, Spain with 94,000, and China with 81,000. If we take a closer look at just the US, as mentioned, the number of cases is at 180,000, the number of reported deaths is at 3,500, and the states with the most cases are New York with 67,000, New Jersey with 16,000, Michigan with 6,500, and Florida with 5,500. In the state of Michigan, there have been 184 reported deaths. Leading the way is Detroit City with 1,800 cases, Wayne County with 1,400, Oakland County with 1,400, and Macomb County with 620. Looking at these figures, it's easy to understand why experts are urging us to flatten the curve. At the moment, the number of cases is increasing exponentially, leaving hospital systems overwhelmed. This means that some patients will not be able to get the medical care they need, and the number of deaths is likely to increase. By practicing social distancing, we can help slow down the rate of transmission, giving doctors the time and resources they need to treat patients and hopefully save more lives. This shows mortality rate by age group. Death rate is defined as the number of patients who will die from the disease over the number of cases. For example, a death rate of 14.8% means that for every 100 patients infected, about 15 will succumb to the disease. You can see that death rates get higher with increasing age. This is because most older adults have pre-existing medical conditions like high blood pressure, diabetes, or cancer, which puts them at a higher risk for complications.
How does COVID 19 spread? Coughing and sneezing produces respiratory droplets that can carry the virus. If you come into contact with these droplets, you may become infected. Another way is by touching objects that have the virus on them. Hands are a vector for transmission, so they can pick up the virus and transfer it to you. How long the virus lives on each object depends on the material. Touching your face and mucous membranes with contaminated objects or your hands can also lead to the spread of the virus. The asymptomatic period of up to 14 days is another reason this virus can be easily spread without knowing. You may be carrying the virus even though you feel fine.
Now we will be discussing the signs and symptoms of COVID 19. Patients should watch out for symptoms of fever, cough, and shortness of breath. It is important to note that some patients may not have all of these symptoms, and other patients may have symptoms that are not on the list. The symptoms that should have you seeking medical attention are trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, or bluish lips or face. If you need to get tested for COVID 19, call the state or local health department or a medical provider. While supplies of these tests are increasing, it still may be difficult to find a location to get a test. If you need more information about how to get tested or when you should get tested, visit the CDC website.
I know that one of the hottest topics when it comes to talking about the coronavirus is the development of a vaccine and potential treatment for infected patients. Many health officials, including Dr. Anthony Fauci, have estimated a vaccine to take about roughly 1 to 1.5 years in order for it to go through all the trials and be mass manufactured for the public. One of the most talked about drugs recently is actually an old anti-malaria drug called hydroxychloroquine that goes by the brand name of Plaquenil. I think it's important to keep in mind as we discuss this agent that it is not FDA approved to treat the coronavirus, but it's a drug that's going to be a potential treatment for infected patients. One of the promising things about this drug is it has been shown to have in vitro activity against SARS-CoV-2, essentially meaning that when tested in a lab, it has been shown to be effective. But as we all know, in vitro activity does not ensure in vivo activity, meaning just because it works in a lab doesn't mean it's always going to be working in humans. One of the reasons that this drug is currently so popular was a recent French study that was published that reported that using hydroxychloroquine with azithromycin reduced detection of SARS-CoV-2 RNA in the upper respiratory tract in patients compared to a non randomized control group. It's important to note that the study did not assess clinical benefit. The study also noted that using hydroxychloroquine in combination with azithromycin does put patients at risk for QT prolongation, so caution is advised when considering these drugs in patients with chronic medical conditions such as renal failure and hepatic disease, or patients who are receiving medications that might interact to cause arrhythmias.
Now that you know more about the virus, this is how you can help. You can directly help prevent the spread of the virus by washing your hands thoroughly and frequently for at least 20 seconds, not touching your face, not leaving the house unless absolutely necessary, practicing social distancing when you do leave the house, which means leaving at least 6 feet between you and any other person, and staying at home if you do not feel well. You can also help by educating others. By getting educated about COVID 19, you can help spread factual information while avoiding myths and misinformation. Use reputable sources rather than relying on social media and news outlets. You can help by donating time, money, or resources to those in need. You can donate supplies such as masks, hand sanitizer, and gloves to frontline healthcare workers and others at increased risk. You can also donate to organizations that are directly fighting this pandemic, such as the World Health Organization. Donating blood is another option if you are healthy and able. If you would like more information on where you can donate blood, go to the American Red Cross website and look for a local blood drive near you.
Here are some reliable sources for you to access regarding information on COVID 19. These include the Centers for Disease Control and Prevention, or the CDC, the World Health Organization, also known as WHO, the State of Michigan website, and the federal government website. These sites should be your main sources as they provide accurate information on what is happening locally, nationally, and worldwide. Help us stop the spread of misinformation and educate those around you. Thank you all for listening to this presentation. I hope that you have learned something new. While all of the information in this video is up to date with currently published information, always be sure to use the reliable sources we mentioned to stay informed with any developments regarding COVID-19.